This meeting is now called to order. For those around the table, please when speaking. For those participating via Zoom, please state your name when making a comment or asking a question. The MAG public comment process allows members of the public to comment on items that fall under MAG's jurisdiction. If you would like to comment at today's meeting, please complete the request to speak form. Staff can assist with any questions you may have. If you parked in the garage, parking validators are available on the information table in the hallway. If you purchased a transit ticket to come to the meeting, please see staff for a ticket. Hearing assisted devices are available from MAG staff. We will now begin with a roll call of members.
Thank you, Madam Chair. When I call your name, please indicate if you are present. Mayor Beck, Mayor Bien-Wilner, Mayor Crane.
Present.
Thank you. Ms. Daniels.
Here.
Thank you. Mayor Dickey.
Here.
Thank you. Chair Gallego.
Here.
Thank you. Supervisor Galvin. Mayor Giles. Thank you. Supervisor Goodman. Mayor Hall. Mayor Hartke.
Present.
Thank you. President Javier. Mayor Hermosillo.
Present.
Thank you. Mayor Lavalde.
Yes, I'm here.
Thank you. Governor Roe Lewis. Mr. Meck.
Here.
Thank you. Mayor Molina. Mayor Morris. Mayor Osborne.
Present.
Thank you. Mayor Ortega.
Present.
Thank you. President Patia.
Here.
Thank you. Mayor Pereira.
Present.
Thank you. Mayor Peterson.
Here.
Thank you. Mayor Pizzillo.
Here.
Thank you. Mayor Rodriguez. Mayor Schoaf. Mayor Schoaf. Mayor Sykes.
Here.
Mayor Schoaf's here.
Thank you, Mayor Schoaf. Mayor Smith. Mayor Walter. Mayor Wires.
I'm here.
Thank you. Mayor Weiss.
Here.
Thank you. Mayor Wheatley.
Here.
Thank you. Mayor Wilson.
Here.
Thank you. Mayor Woods.
Here.
Thank you. Madam Chair, we have quorum.
Wonderful. Thank you. Thank you all for joining us. Will you please join me for the Pledge of Allegiance? I pledge allegiance to the flag
of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Our next item is call to the audience. This is the opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda, information, discussion, and not for action. 15 minutes will be provided for the call to the audience unless the chair requests an exception to this limit. We have Diane Barker.
Thank you, Chairwoman Gallegos and MAG mayors. I'm Diane Barker, and I believe in multimodal transportation, as contentious as it is. I was over at the Board of Supervisors. Some of you may know Mr. Crawley. He is a native of Arizona. He's quite knowledgeable. He's a friend of mine. He can be kind of ornery and difficult to get along with sometimes, but it seems like that he has a good perspective a lot on transportation, and he, as myself, actually walked the talk. So as he was speaking at the board, they were going to, on item 41, authorize RPTA to have the money for the travel demand program, which, you know, is something that MAG uses as a value to cut down on the on-road emissions, because we have, you know, it started out for the state, that program. I think it's a good one. Fast buses coming in with our government workers, timely getting to work and then back home. It was something that when I found out about it, when I came here and lived in Tempe, I started riding at the 531. And I said to somebody as we were passing all of the traffic, Yeah, what do we know that they don't know? Because it was so easy to get home and the price was right and like that. Well, anyway, back to that, in the end of his commentary, he said, I'm looking at this plan that MAG has, and he says, I really don't see where they are expanding the bus in the way the bus is a flexible way. If the route's wrong, you could take it out, unlike fixed rail, but they cater to the rail because it has so many people involved in it, which huge money stream, got to be the bankers, and even the lawyers left the FTA and got on the bandwagon with it. So that's fixed. And you have to deal with the accidents. Just so you know, I haven't heard back from them, but I asked for the number of crashes since 2008 and the cost that we are paying, and the cost of public is, I understand, the automobiles, which they blame automobiles, and they make these left-hand turns. 85% of crashes come from that, is don't carry enough insurance on that. And so anyway, I still believe in multimodal, but if we don't watch out where we're going, we could end up there. Now, I have a bus pass, and I thought, something, the guy that was trying to help me and he took my bike, I found a guy that did the other thing, and I rewarded him with the bus pass, and I said, hey, I really appreciate it. Pay it forward. And he got off and took my bicycle off for me and helped me. So there's good people. Thank you.
Thank you. To our staff, do we have any additional comments?
Thank you, Madam Chair. We have not received any written public comments through our online website.
Thank you. That is all our in-person public comments for call to the audience. Informational items. Item 4A is for information only. Does any member of the committee have any questions or request a presentation on this item? Hearing none, the next agenda item is number 5, approval of the consent agenda. Items 5A through 5G are on the consent agenda. Does any member of the committee have any questions or request a presentation on any of these items? Hearing none, is there an, we do have Diane Barker to comment on the consent agenda.
Thank you, Mayor. Chairwoman. I'm reading now, this is from the website of MAG, and they refer to the ozone pollution advisory, and it's out of the ADEQ, which is an acronym for the Arizona Department of Environmental Quality. And we have a high pollution alert day. We have serious ozone, or they call it moderate, but it's headed serious, particularly in the summer. And the particulates, you can drive as little as possible, carpool, or use public transit, and use Metro Share a Ride. Fuel your vehicle after dark and during cooler hours. Use low VOC, volcanic organic compounds, or water-based paint, stains, finishes, and paint strippers. Delay big painting projects until high pollution advisories and health have passed. And make sure the containers of household cleaners, garage and yard chemicals, and other solvents are sealed properly to prevent vapors from evaporating into the air. Eliminate wood burning in fireplaces, stoves, chimneys, and outdoor fire pits. Avoid using, I'm going to say this loud, avoid using leaf blowers. You hear that? They're all over. They've lobbied so hard at the legislature, you can't get rid of them. Many times a broom is all you need. And so really, if there's people can use a little more common sense, conserve electricity. And it was coming from Burton Bar. Yay, we have a cooling center there and it's working, I understand, Mayor. And the thing is that I stopped over by the Foundry Hotel and went to the girls' room, and the lights were out. And a woman came, this is where our cell phones are coming into handy, with the light on her cell phone in there. And the maintenance man, I know him, and he says, the transformer went out. And then I get an alert, on my phone that APS has transformer out. Now, if in fact we're pulling, because I already seen people are putting their air ACs up high, if we're pulling down on this energy, we may have some more outages. So these generators that the city of Phoenix and some of the rest of you may have may come in handy in cooling centers. Thank you.
Thank you, Diane. For our staff, do we have any online or additional comments?
Thank you, Madam Chair. We have not received any online written comments for the consent agenda.
Is there a motion to approve items 5A through 5G?
So moved.
Mayor Osborne,
Second.
second Mayor Harkey. We will have those participating in the meeting online take part in the voice vote by turning on their cameras and unmuting their audio. We need to see the faces of everyone to participate in the voice vote. For those who cannot or do not want to turn on their cameras, staff will conduct a roll call. Staff will only call on virtual participants who did not turn on their camera. Members, please leave your cameras on until after the roll call vote so staff can count people's names whose camera. Can I have a voice vote of those in the room and those online? Those in favor say aye.
Aye. Aye.
Nice job. Those opposed say nay. All right, staff roll call.
Thank you, Madam Chair. All cameras are on and the motion passes.
Nicely done, everyone. Next is item 6, statewide heat efforts, and I'll turn over to Ed Zerker to introduce this item.
Thank you, Madam Chair, Mayor, members of the Regional Council. As you remember, last month we had a presentation on the regional heat efforts, and today we're going to have a presentation on the statewide heat efforts. Just a bit of context, as someone who's been involved in local government for over 30 years here, like many of you, it's relatively new to have discussions about heat as a policy item, but here we are. So I think what's happening is, first of all, the significance of Phoenix metropolitan region in the nation means that what happens here becomes more noticeable on the national stage. I think nationally there's a larger awareness of large-scale public health issues. And as we heard last month from our county health folks, this was a large-scale public health issue last year with our record-setting heat. Perhaps it's the Weather Channel effect, where every weather phenomenon now has a name and a logo and a banner on the Weather Channel. So we'll see this year if heat gets a name, named as a storm, and it's also just objectively getting hotter here. So all those things have led to attention on heat for us. And fortunately, through your leadership, MAG has been a leader in heat relief since as long ago as 2006. And as a desert region, we're built for heat. It's not such a big story to us as it might be nationally, but it is a big story nationally. And so after last year's record-setting July, we gathered with Kelly Williams and her staff in Human Services, our partners at Maricopa County, to talk about how we're going to prepare for this summer's heat season. And here it is upon us. It hasn't quite felt like it yet, but it is coming. And so part of it is Mayor Gallego placing on the agenda this month a request for the state to come talk about the statewide heat relief efforts, of which our heat relief network is part of that. So that's sort of where we are. And Kelly Williams, our Human Services Director, is going to introduce our guest today. Just a side note, I would say this is Kelly's last meeting with us at MAG. She is moving to a great opportunity as Deputy Director at Maricopa County Public Health Department. It's very exciting. Job for her. And yes, thank you for recognizing her work here. We are sad to see her go. We're glad that she's staying in the county to help on a very significant level. And with that embarrassment of Kelly, I will let her introduce our guest.
Thank you, Ed. Thank you, Madam Chair and members of Regional Council. As if I wasn't nervous enough. Thank you for the opportunity to introduce my colleague, Dr. Eugene LeVar. He currently serves as Arizona's first Chief Heat Officer. He was appointed into this role in 2024 and oversees the implementation of Governor Hobbs' Extreme Heat Preparedness Plan. He began public health work at ADHS in 2012 as an epidemiologist, assisting with state efforts covering border health and unexplained deaths. Most recently, he was the Assistant Director of Public Health Preparedness. The Assistant Director role encompassed leading and overseeing 6 critical public health bureaus. And we're very glad to have him here today to talk about health preparedness and heat relief. Dr. LeVar, the floor is yours. Thank you.
Thank you so much. Can you hear me?
Yes, we
Wanna
can.
make su- Okay, thank you. I just wanted to double check and make sure that that was coming through. I appreciate the invitation and the time to be on today's agenda, and thank you so much for having me. As mentioned, I was appointed as Arizona's Chief Heat Officer when Governor Hobbs issued her Extreme Heat Preparedness Plan on March 1st. A little bit about that particular position, as mentioned, there is an inclusion of heat-specific efforts between agencies on shelter, energy, health, and disaster response, and a coordination aspect of it in partnership with the Governor's Office of Resiliency. And that includes engaging state agencies and other state, local communities such as yourselves and private sector partners as we move forward from heat season to heat season. The role also includes being a connection between local and federal partners to help bridge communications in and outside of heat season, to make sure that those communications, whether it be just resource sharing, information, and other pieces, can happen fluidly, and hopefully there's no gaps as we move forward. If I could have next slide, please. Thank you. So looking here, I just wanted to give a little bit of agenda of what we'll be covering today, and we'll go ahead and start with just an overview of extreme heat in Arizona, a little bit about what has been going on recently with heat in Arizona and what made 2023 different. Next slide. So right here, you can see a state heat map that's showing an increase of monthly temperatures over time. Not only are the maximum daily temperatures increasing, but we're also seeing an increase in the minimum nightly temperatures. And these increases are not allowing individuals to cool down if they have a lack of cooling options before the start of a new day and seeing those heat temperatures rise again. And that's compounding the issues and factors that we're seeing as we're moving forward from heat season to heat season as these temperatures are creeping up. Next slide, please. So July 2023 was the hottest summer month in Arizona for 14 out of 15 counties, and it was the second warmest for that 15th county. I have been on several webinars and panels and other summits on those ends, and they use the word unprecedented over and over again. And I do think that is what we saw in 2023. It was an interesting summer to go through. At that time, I was wearing my Assistant Director of Public Health Preparedness hat and looking at it from that preparedness viewpoint and seeing some of those actions and items and communications that were happening and looking what I can do for lessons learned moving forward. Next slide, please. We'll go a little bit over the state's extreme heat preparedness plan now that we reviewed a little bit about the impact of heat in our state. So we'll look at what can we do in 2024 and what can we focus on beyond 2024. Next slide, please. So we discussed heat in Arizona and what was seen in 2023, and this triggered a call to action. In August of 2023, Governor Hobbs issued her executive order, which required the Director of Governor's Office of Resiliency to coordinate and lead an interagency effort to develop an extreme heat preparedness plan by March 1st of this year, among other actions and priorities. And those included developing legislative proposals to protect the elderly, children, medically vulnerable, and other impacted communities, administer the Department of Energy Grid Resilience Grant to improve grid resilience in their state, create and lead the Interagency Resiliency Forum to support efforts to respond to extreme heat and other state resiliency and sustainability efforts, and work with state and local agencies and external partners to collect innovative solutions to address extreme heat and provide cooling relief to Arizonans. So we saw the primary parts within the plan include cross-agency preparedness for heat season in 2024, and also long-term policy and operational recommendations for 2024 and beyond. Next slide, please. So short term, what are we seeing for heat season in 2024? So we have 4 primary areas that we're focusing in on, as you can see here. And those are shelter, energy, health, and disaster response. And within one of those, we have independent items that we're really focusing in on too, and what we can do to achieve a better position and preparedness state as we're going into heat season this year. Just to highlight a few, I don't want to have to read the slide to everybody. I'm sure nobody wants that, but we can just look at shelter to begin with. Looking for grants for emergency shelter, hiring of a heat relief coordinator for the state, solar powered mobile cooling units, and cooling center staffing are examples of some of the more granular dive-ins that we're seeing for this heat season as we move forward. Next slide, please. And then we have a whole group of long-term recommendations. I think one of the things we know with heat season and how we're going to get better year after year within the state is that we're not going to solve all the problems or issues within a 6, 12-month, or even 18-month period. This is going to be an ongoing learning experience. We're hoping to go through each heat season being better prepared than the one we had before. We're also hoping to look at what are best practices, what are some items that maybe didn't work so well, what are some items that we need to have flexibility with and reevaluate to be better prepared going into the next year. And so looking at that, we need to have a long-term vision as we go forward. So long-term recommendations include some of these key components here, and you can see there's some crossover with what we saw for those short-term recommendations too. So there's a focus on safe and affordable housing. We also have a look at going through and adapting some of the approaches on that end. I'm so sorry, my screen blinked a little bit. And updated emergency response, cooling center network and supports, and looking at data sets, knowledge, and workforce development. And really, we want to be able to have timely data available to us so that we can do public health actions appropriately, improve that knowledge base set amongst our community members, and making sure that we're getting resources and messaging out to them that they can utilize. And then also making sure that we have a workforce to deal with the issues and items that we have within our state. And that could be something from the HVAC repairs that need to get done within our state to the healthcare systems and responses that need to happen in case we see an increase in heat-related illnesses or death as we go forward. Next slide, please. So when we look at the plan, we start thinking about implementation. We need to keep a couple of things in mind. As we look at current efforts, we need to make sure that stakeholders are meeting regularly. We're researching funding, especially if it's sustainable. Identifying gaps in implementation needs. We need to prioritize ideas and policies and ongoing identification of projects and proposals. And we need to have a health equity lens as we go forward. We recognize and template great work that's been done within our urban areas of the state, but we need to provide attention to rural areas and vulnerable individuals that may not be benefiting from current heat response efforts. I think it was highlighted a little bit before I came on about the great work that MAG has done working with Maricopa County Department of Public Health and some of the other entities within the county. Unfortunately, some of our other jurisdictions aren't as well prepared or far along with their planning and efforts. And so looking at this from a state position, we need to make sure that we're having a view on the preparedness across the state and seeing what we can do overall for the infrastructure within our urban communities, but also our rural communities and our tribal communities too. Next slide, please. So I just wanted to share, looking at this graphic here, we can see a tiered approach for implementation. If you look at the top, we have the Office of Resiliency's Intra-Agency Resiliency Forum. And this forum is made up and comprised of state agency leaders, decision makers, with a focus on preparing for extreme heat events and other resiliency efforts. Below that, we have an all-partner working group called the Arizona Heat Preparedness Network. And this group will consist of all members in the work groups and any other members or organizations that would like to stay up to date on heat relief activities occurring in the state. And the network will ensure that there's a statewide interest and that they're incorporated into all activities to build statewide capacity and ensure robust input from tribal and local governments and cross-sector stakeholders. Below that, you'll see that we have some state work groups that are identified, and there's 6 there. One of them is specifically for state agencies and the work that was identified within the recommendations of Governor Hobbs' plan. And then we have statewide community groups that help drive the efforts and feed information up to the Interagency Resiliency Forum group. And those cover some specific areas that were identified: sustainability, policy, and innovation, building a strong infrastructure, communicating and promote heat resiliency, data to enhance resiliency, and heat relief coordination. And then below that, we can have task force teams that are identified if any specific tasks or items need to get completed as action items from those state work groups. So it's often a question that we get is who's within these work groups. So we have over 100 participants, and they cover a large gamut of entities. We have county and municipalities. We have tribal participants. We have nonprofits, community-based organizations, and faith-based organizations. Also local businesses, hospitals, and various healthcare centers. So I just wanted to highlight here, we do meet about every 2 to 3 weeks to go over the agenda and items that we're working on within these work groups. And we're going to get ready to have our 4th meeting within these groups, and those are going to take place in the beginning of June. Just wanted to mention for awareness that those are ongoing and we do meet regularly. Next slide, please. Thank you. I'm sure some are interested in and if we are having a standardized approach for heat season in 2024. And these are our heat response activation tiers, thresholds, and activities. And I'll cover these at a little more granular level, each one of these tiers, and the next couple of slides that we'll review. So we'll go to the next slide. So we have a tier 0 that was identified. This is a pre and post heat season that will usually run from October 1st to April 30th. Behind the scenes during this time, there's a lot of off-season work that can get done every year. We can look at evaluation and planning, work groups, a certain event such as our Arizona Heat Planning Summit, also our Extreme Heat Planning Workshop, and getting ready for Heat Awareness Week to get everybody ramped up and ready to go for heat season year to year. And we can also update educational campaigns and resources such as toolkits that we develop and have ready to go for various communities and cohorts. Next, we have tier 1, which is heat season. Now that usually runs from May 1st to September 30th. As you probably know, here within Arizona, we also see elevated temperatures sometimes through October. So that's something we're keeping an eye on and why we say those approximate dates as we go forward. And this is for pre-posturing, and it provides, that life-saving assistance through the Arizona summer. And we really lean on the National Weather Service heat risk categories 1 through 4 to help identify where we're at during this particular tier. And there's certain actions that get started as we kind of go into this time frame and go into this tier. And those can be from opening heat relief centers, doing heat alerts as they're needed and identified, partner meetings, cooling center work groups, looking at assistance mechanisms such as 211, social media campaigns, heat relief center maps, coordinating resources as we go forward, heat illness dashboard updates that start at the beginning of May, and looking at free or reduced bus passes and ride-share vouchers that some of our communities institute. Next slide, please. Here, I just wanted to highlight what was that National Weather Service categories that we lean on. These can be found within the links, and I believe my slides will go out to the group here, and you can see that each one of those levels are identified with some impacts. And that's something that works into that system and works into those thresholds that we've identified and gives us a standardized approach as we take next steps. Next slide, please. Now, within tier 1, we have subcategories depending on what we're experiencing during each heat season. So just wanted to highlight here that the heat risk values of 3 and 4, those are identified as major and extreme. And what that initiates is going into real-time communications to alert partners to start ramping up heat interventions. And those can be everything from planning to extend heat relief center hours to communicating needs and gaps that they're having within their communities, looking at planning, staffing, and backup support, and increasing outreach to high-risk populations when we get into this cautionary period. Next slide, please. So then if we're going along during heat season and we're seeing that we're going to be experiencing an exceptional heat event that's defined as having National Weather Service excessive, which are major or extreme heat warnings for 2 days in a specific location or county. And also if we're seeing an exceedance of what we saw within the top 10% for either heat-related illness emergency department visits or heat-related EMS dispatches, that's going to trigger us going into a tier 1B, which is this exceptional heat event criteria and posture. And if we go into that, we also have some metrics and thresholds of when we pull out of that. And when we pull out of that is when we no longer see those advisories over a 3-day period, and we get either those heat-related illnesses from ED visits or those EMS dispatches, whichever one was elevated, or if they were both elevated, back down below that top 10% that we had seen over the previous 3 years. One thing to note is that it's important to really take an insight here and know that being within an exceptional heat event, tier 1B, does not automatically initiate an emergency declaration, but the posturing that we have will help inform leadership of current situational needs assessments. And in case there is a need to have a consideration for emergency declaration, they will be well informed and will be well postured to providing information that they may need. Next slide, please. So some of the activities that can be initiated by going into this tier could be activating our State Emergency Operations Center or our Health Emergency Operations Center here within the Department of Health. Also looking at increased communications, alerting partners to initiate emergency response interventions. And you can see some of those listed here that range from extension of heat relief center hours, looking at extending and abilities to have some flexibility with moratoriums, also looking at increased distribution of resources, and then once again, looking at some of those transportation needs that may be needed by our vulnerable populations. Next slide, please. So one of the things we know about Arizona is that to expect the unexpected. And so there's always a chance that you may have multiple emergencies occurring simultaneously. And so if that does occur, we have a tier 1C that we can initiate. And so if emergencies are occurring simultaneously, you can see an increased burden on communities for resources, health outcomes. Also, it can complicate response efforts. And these can happen if you're having an heat emergency, also compounded by power outages, transportation interruptions, outbreaks, healthcare system overloads, or extreme weather, such as monsoon floods, air quality issues, or smoke. So some of the activities that can be initiated with that are ramping up the operation and collaboration with state, federal, and local agencies. We can also look to preparing public health messaging and address environmental health and safety, medication safety, respite and refuge locations, and resources as a few examples of some of those activities that can be initiated. Next slide, please. So if we do go into an emergency or have multiple emergencies, what we're going to be looking at is what happens after those subside. And so you really need to look at recovery, correct? And so if and after a heat emergency is rescinded, or some of those multiple emergencies are happening, are rescinded, recovery is led by the Department of Emergency and Military Affairs. And we really look to evaluate recovery support functions, also the CERT plan, and looking at infrastructure systems, economic recovery, natural and cultural resources, health and social services, community assistance and housing. And then we also make sure that we have coordination happening across multiple agencies and making sure that community is leaned into to address latent impacts post-event that could be occurring. Next slide, please. Thank you. So there was also, when I was pinged to present today, just kind of an awareness of what happens in case there's resource needs within our state. And I know this may look a little bit like spaghetti thrown on a wall here within this algorithm, but I'll do my best to give some narrative around it. So during situations that when we get into heat season, we may have resource needs that are identified. So what we're looking at is overall as a state, in addition to working together to implement plans, partners can utilize established emergency management processes for resources. So local incidents that have identified resource needs would go through their local health and local emergency management. They would then work with the requester on essential information that's needed to validate the request. And then if they are unable to fill the request, they would forward it on to local emergency management. And then they would go through that same process. And if they were unable to fulfill the request, they would then submit it to state emergency management, who would then review the resources and see if resources were available. They would look to determine if they could fill the request, which could include looking at mutual aid or other options. If they're unable to refill the request, they'll work with state health. And then state health will evaluate any ability to fulfill resources. And then if there's no way for us to fill those resources, it would then be shared and we would be paying our federal counterparts. I think it's important to look at this display here to just see the process narrative is covered within this algorithm, but there's some important caveats. Requests for resources must provide evidence that all existing resources have been or are expected to be exhausted prior to elevating the request to those different levels of local, county, state, and federal, and including assistance from system partners, supply chain solutions, and fiscal capacity. Also, information should include how the requesting entity has been unable to acquire the resources that are being requested and how the entity has attempted to mitigate the need prior to making the request. Also, request requirements may vary at the local public health and emergency management levels. So requesting entities should consult with their respective governmental organizations to ensure an understanding of those resource request requirements and processes. Next slide, please. So looking at, I just wanted to highlight, so what's new for 2024? What's different from 2023? So my position was identified. We're also looking at enhanced coordination amongst statewide efforts. The executive budget identified funding for hazard mitigation and emergency response. We have construction of 10 retrofitted shipping containers that are actually mobile cooling units for community distribution, and we're working with entities to get those out. Also, state employees can opt to staff cooling centers and receive regular pay so that hopefully we can bolster that infrastructure and volunteer work that's being done. Also, we've identified thresholds to enhance heat response activities that we just reviewed a few minutes ago. Also, centralized state and county dashboards to display heat-related illnesses and death data. And then a really important piece that came through for legislation was House Bill 2146 that was immediately effective for mobile park homeowners, that they can't prohibit ACs or other cooling accessories on mobile homes. And the Governor's Office of Resiliency identified $13 million in grant funding to make necessary grid improvements in rural areas. Next slide, please. Also, our state agencies have stepped up. So we have our Arizona Department of Housing. They funded 4 new awards to expand existing emergency shelter responses to severe weather. They also expanded heat relief funding and allowable items. Our Department of Corrections, Rehabilitation, and Reentry is implementing excessive heat safety and relief strategies, and they're starting capital improvement plans for energy efficient HVAC systems. And then we have our Department of Emergency and Military Affairs. They updated their CERT plan, and they're also evaluating how to better measure impacts of extreme heat events utilizing community lifelines. So I know I just had about 5 to 10 minutes. Hopefully I haven't exceeded that too much, but just wanted to share some resources on the next slide that'll be available to everyone. If we go to the next slide, please. And this just goes over some of the information and items that we covered, from the executive order to the plans, additional recommendations and findings, also some web pages and websites that are available at our state level, and then also a CDC heat risk tool that may be useful for folks on that end. So I just wanted to thank you for the time and opportunity to present today. I hope some of the information was useful. Maybe some new information came to the table, and definitely available for any questions, and I'll do my best to try to answer those. Thank you.
Wonderful. Thank you so much for the presentation and the work you are doing. I am glad that Governor Hobbs has created the Chief Heat Officer position. We certainly had a lot to do better after last summer, and have a chance to save lives and improve quality of life for our residents. In the city of Phoenix, we had last summer only 1 overnight cooling center, and this year have added 3 new ones. Could you give us an update on how many overnight cooling facilities there are that the state has supported, and how many there are?
Sure. A lot of those are supported on the community levels. And so we're working to organize and making sure that there is mapping available to all of them. And I know actually Phoenix actually did their first 24/7 cooling center too. That was initiated on that end. I think right now we're cataloging within our work group exactly how many extended hours and overnight centers are available across the state. So we hope to have that information available soon.
Wonderful. Thank you. And you sort of implied that we would go to the state when city resources were exhausted, but I just want to say that from my perspective, heat is everyone's challenge, and we shouldn't need cities to do all of the work. It should be every level of government. We know this is coming, and we ought to plan for it and not push for cities to work till they're exhausted of resources before
That
stepping
is
up.
very true. Definitely would agree with that. And I think it's more of just a process of identifying when some of those limitations may happen on a municipal level, and then being able to work with your county public health and emergency management counterparts. A lot of times, like you said, we know this is coming from year to year, and it's one of those few even natural items that come to the table. Hurricanes have a short lead-in time. Certain storms and other pieces have short lead-in time, but heat, we know it's going to be here every year. And so it's one of those items that I think we can really look at and prepare for. And a lot of our work since I stepped into the role has been more of that preparation, coordination, collaboration, starting conversation, make sure everybody knows who's at the table, who to get in touch with in case issues do come up, and then looking at what we can do to kind of establish a standard going into 24, knowing that this is going to be an ongoing and improving process from year to year, but hopefully we're in a little bit of a better prepared state and then be able to work through some of those assistance or needs that come through in a timely manner.
Mayor Weiss.
Thank you for the presentation. Very in depth. Couple questions for you, and I may have missed out one of the flow charts, but I think when our teams from the cities go out, so paramedics, firefighters respond to a heat related call. A lot of times those calls can be treated at the scene. The person is given treatment, rehydrated, checked on, but a lot of cases they're transported to a hospital that may be nearby, depending on the severity of that case. Can you touch on the integration of the hospital network with the governor's plan on that? And the second comment I have is in the city of Avondale, and I don't know if we're unique or if it's something that happens valley-wide, it's not the issue that we don't have enough cooling facilities or enough resources for people who get out of the heat. It's that they choose not to come out of the heat, even though we go around and pass out pamphlets. We have a team in Avondale of 6 people called Sonar, and it's our homeless outreach team. They do yeoman's work trying to get the message out and trying to get people who are the most vulnerable on our streets to go to these cooling centers is not working out. And I'm wondering if that's the case in other cities and what other cities have had success in getting past that objective.
No, I appreciate the questions. And looking at healthcare capacity and those pieces, we're working really closely with the state agency DEMA, which is the Department of Emergencies and Military Affairs, looking at those capacities and what can we do. And that is a component of the community lifelines that are identified by FEMA. And making sure that there is an ability to serve those individuals that do get transferred and they have their needs met going forward. So that is something that we're looking at, and that is kind of a standard approach when it comes to preparedness, which is a little bit of my background, making sure that keeping an eye on that infrastructure and those capacities going forward. I think it's an interesting one with the item that you mentioned about individuals just may not be going to some of those resources or may not. And is it an awareness? Is it an educational opportunity on that end? We looked at the preliminary numbers for heat-related deaths for 2023 in the state. We were over 900. One of the really surprising facts is nearly 50% of those individuals lived with Arizona for 20 or more years. And so one of my greatest fears is kind of either the complacency or the unknowing or unwillingness to seek resources or those available cooling centers or other items. I think often in Arizona, we hear talk about the dry heat and people are accustomed to those heats. But when you see those numbers and the percentages that are impacted by residents that have been here for 2 decades or more, that's really eye-opening. And I think that's one of the things we're really looking at within our communication work groups and how we can better get messages out to individuals who need them. Also making sure that they're aware of the severity of the impacts that can come with heat. Also know resources and relief, that messaging is getting out to them. And we're also working really closely with several partners, be that local governments, county partners, and also the American Red Cross to help get that message out there and get teams out on the streets to help make sure that they're aware and making sure that our messages are being heard on that end. And I don't know if that totally covers your question, but hopefully that's a little bit of an insight where we're coming from, and would be interested to hear about other municipalities as they're having similar impacts. So something that we can make sure that we're identifying and focusing in on.
No, you've helped me. I appreciate that. Thank you.
Mayor Giles.
I've really appreciated the last meeting we had. The Dr. Sunshine from the County Health Department was here talking about this, and I have to say that I was really shook by that 645 number that she shared with us. I think we all collectively ought to be very embarrassed by that. In a first world country, we should not have 645 people dying on the streets of Maricopa County due to heat-related causes. And so I appreciate that the county has a health department, the state has a health department, we do not. And this presentation and the one that preceded it by Dr. Sunshine, I think are very helpful. And the funding that's coming to our communities is very helpful as well. So the data and the funding are great, but I think we all need to realize that as mayors and as cities, we need to own this problem, because it's great that the county and the state have plans, but they're not the ones that are going to implement them when there's, the people that are going to be responding to this are our fire departments and our social service people. So after last month's meeting, I went to our council meeting and I said, we need to have, it's great the county has a plan. It's great the state has a plan. Those are meaningless unless there's a city plan. And so tomorrow morning in our study session, the staff will be presenting what our city action plan is for heat relief. And it includes additional navigators and Dr. Sonnenschein came out and did a real deep dive on the data with our city staff. And it was very enlightening. I think that the report that she prepared, everyone ought to read it. There's some things in there that are not intuitive. It's only like 40% of these deaths are unsheltered. The rest are a lot of people that, for financial reasons, they have an air conditioner, but they're choosing not to use it, or they financially can't use it, or home repair issues, and it's remarkable the tie between substance abuse and these deaths. The physical impact that drugs have on a person's body to be tolerant of heat apparently is very significant. So my point is, I think we all need to, like I say, we need to own this issue. It's not the state and county health departments that are going to be impactful in changing that number. They play a role. Thank you very much. But for this to be a call to action, I think those of us around this table need to own this issue. And I appreciate Mayor Gallego, you being outspoken about this, particularly the fact that FEMA funding is available for every other weather-related emergency in the country, but not for extreme heat. That doesn't make sense. So we need to be raising awareness of that at the federal level, get additional federal funds, and take this data from our state and county health departments back to our communities and turn it into an action plan.
Wonderful. Mayor Giles, thank you for your leadership on heat. All right. Thank you so much, Dr. Leiber, for joining us for today. We appreciate it and wish you
Thank you so
well
much.
on all of our behalf.
Thank you so much for the opportunity, and we will continue to work with our state agencies to make sure that we're pushing information such as the low-income home energy assistance program, hearing, about, we do have those who are homeless or unhoused that are definitely disproportionately impacted, but we have those that are within a home setting, and what can we do to bring relief? But then also looking at a state government and working with the Governor's Office of Resiliency to advocate for an appropriate sharing of FEMA funds and getting adjustments into the policies that are out there, so to make sure that heat is identified and moving forward gets its fair share of funding for relief and efforts. And that is definitely a priority on our end too, just to mention that.
And it
Thank
looks
you
like
so
I
much,
missed
everyone.
Mayor Wires. Did you want to comment?
I did. Something I don't think most people are aware of, and how terrible this really is, how deadly this is. We had more people die in Maricopa County last year in about 4 months' time from heat-related deaths than accidents in all of Maricopa County last year. Think about that. Think about the billions of dollars it's spent to protect people driving in cars, seat belts, airbags, stop signs, all of that. And we got more people dying from heat-related. It's astonishing. It blows my mind. Our city increased our heat relief stations, and yet it's not just that. There's a lot of pieces to it, but it just blows my mind that we grasp the things that we think we can control, and yet the things that are the easiest seem to be the worst.
Thank you. That's a powerful statistic and one that hits hard. All right. Thank you so much, Dr. Leiber. We will next go to number 7, Electric Vehicle Charging Infrastructure Program Guidelines, and welcome Patrick Stone, Deputy Director for Programming, Deputy Transportation Director for Programming.
Thank you, Chair Gallego, members of Regional Council. Good afternoon. Pleasure to be here to present this item today. So 3-pronged approach today to my presentation. First, going to do a brief overview on the carbon reduction program itself, what it is. Then go a little further into the electric vehicle charging infrastructure program, that which we're discussing today, and then the proposed steps to program those funds for the region. So first, high-level overview of the carbon reduction program. The program itself was created as part of the Infrastructure Investment and Jobs Act, or IIJA. And I really want to kind of focus on the center square here. We talk often about the Regional Strategic Transportation and Infrastructure Investment Plan, or RSTIP. And so sometimes it feels like this could be a disconnect. The RSTIP was approved by this body back in June of 2021. Unfortunately, the carbon reduction program as part of IIJA was not in place at that time. Ergo, it wasn't considered as part of the investment plan. So what we did is we brought an item through the committee process last fall and got direction from regional council about how to attack carbon reduction program funding available for the region. So the policy direction given was really to bifurcate the process and to look at two specific avenues of programming funding. First, electric vehicle charging infrastructure. And then second, also putting funding towards electric and hydrogen fuel cell technology in the transit space, both for vehicles and infrastructure. Today, I really want to take my time to focus on the EV charging program. As you can see on the screen, approximately 60% of the $50 million in funding available to the region is dedicated towards this effort, just under 30 million. And the intent is to deploy charging infrastructure throughout the region. And one thing that was interesting, and I'll come to this in another slide, when we started investigating EV infrastructure and deploying it in the region, a consensus came through a working group that there probably needed to be an opportunity to get those agencies that might not be as far along in the EV space up to speed so that when we talk about deploying charging infrastructure in the region, we're doing it equitably and region-wide. And the one thing, and it is a tenet of the carbon reduction program, so this is actually part of the law, is that these chargers must be publicly available 24/7, 365. So EV charging infrastructure in and of itself, there were 4 goals the group identified as part of the program. One is to support the deployment of charging infrastructure to support economic vitality in the region. Also consideration for both unserved and underserved communities, fill existing gaps in the charging infrastructure network, and ensure that we have a reliable and affordable charging infrastructure network. To that end, we convened a member agency working group, had multiple meetings over the last few months. And out of those meetings, we developed the guidelines that you see a cover of on the screen. Meetings were really kind of helped to define the process, what we should be including in these guidelines. That consideration of siting plans came out of that. And also the scoring and weighting criteria used to evaluate was included as part of that. So we have the funding, we have a plan. How do we actually translate that into action? So there's really that twofold process. First is developing siting plans for member agencies, and then second, moving into implementation projects. So for siting plans, the intent is to make available up to $100,000 per agency. Approximately, we're estimating $1.5 million will be used for doing the siting plans. And this is really, I think, the key component of this. While we talk about the carbon reduction program, the siting plans are actually being funded with regional funding sources. That gets us out of the federal process and hopefully will accelerate the, I see Chair Gallego nodding. The federal process does come with its own unique requirements. So we made a conscientious decision, and working with our partners at ADOT, they were a huge help in this, to be able to have regional funding available to allow member agencies, A, to control the development of those siting plans, and B, to get them out a lot quicker. And to that end, member agencies will actually be able to do the consultant contracting to get those firms on board to assist your agencies in developing the siting plans. And one thing to note, as all things regional, they are funded on a reimbursement basis. So member agencies need to actually fund the plans, and MAG will reimburse the agencies for work. Timeline for the siting plans. As we sit here today on May 22nd, we're taking the guidelines through the approval process with regional council consideration today. Working on the assumption we have that approval, the intent is this afternoon after this meeting, we will actually get the call for projects out on the street. So we'll be going through our normal distribution channels to get that out to member agencies. And then once we get those awarded, the intent is to have member agencies develop the siting plans over the rest of calendar year 2024. This is a high lift for member agencies. Apologies, but to get this going, we had to go this route. We're going to have the siting plan applications out for 1 week. So applications will be due back to MAG on May 29th at 5 p.m. I think we've done a good job of getting this message out there, but we'll continue to communicate that out to member agencies to get the applications in. And the reason being is, go back. We intend to bring the approval of the siting plan applications before this body next month. For implementation projects, balance of funding available approximately $28 million. We're tentatively looking at the beginning of calendar year 25 to do the call for projects to actually have the application process out there. The funding will be for fiscal years 2025 and 2026. The funding is, and as you can see the graphic on the screen, two types of chargers, both level 2 and level 3 chargers. Working with the working group, we did identify that we will have separate applications for the two types of chargers in the region. And then finally, member agencies can either submit a single agency project or work with their partners and do a multi-agency jurisdiction project. And with that, Madam Chair and members of Regional Council, that concludes my presentation. I'd be more than happy to answer any questions you have. Thank you.
All right, we got to move quickly if we're going to be the Electric Valley. Questions? Motion?
Madam Chair, I'll make the motion that we approve the item.
We have a motion and a second. Time to turn on your cameras. Can I have a voice vote of those in the room and those online? Those in favor say, I'll give people a second to turn on the camera. Sorry, that was very abrupt.
Mayor, I think we do have public comment before the vote.
Oh,
Do-
okay, I wasn't given any public comment. All right.
Yep.
All right, Diane Barker, I'm
Apologies,
guessing.
Mayor, we did not get that to you, but
Perfect.
thank you.
They gave me two Dianes and I apologize, Diane. It's just Ed, if we got to have the plan due next week, we gotta, we gotta get going.
Thank you, Mayor Gallego and MAG Regional Council. I did get to have a little conversation beforehand, but I've had experience driving the hybrid, the gasoline and the electric, so I have never ever used one of these pumps. But I see that it seems to work at the Biltmore shopping, Macy's, and they have a bicycle rack right next to it, and it's covered in the garage, which I would think that, and it sets off by itself. It's not directly in with the rest of the cars. Well, on one side anyway. So it would seem to me that you would look for spaces that could be utilized similar to that. And I was just wondering, in the funding that I understood by reading the paper, and it's a little different. It looks like you've changed, some of that. Is that an earmark from the federal government? Because if it's anything like Valley Metro, their last material I read, they're only paid, they've only received a third of the monies that they were supposed to be getting. And that's the way earmarks are. They're an incentive, and then you have to pay back. So this 50 million, I understand 60% of it is going for these electric, and they're moving up. It was supposed to be 10 million a year into your communities, but now it looks like they're escalating it if they can. So my question is this an earmark?
Madam Chair, members of Regional Council, Ms. Barker, thank you for the question. This is actually formula funding that's allocated to the region as part of IIJA. So it's actually built into the Federal Surface Transportation Bill. It's not an earmark. So the funding we get is the funding we expect to get. Thank you, though.
Thank you. Is that all we have for public comment? Perfect. Now, if we could ask everyone to turn on their cameras. All those in favor, please say aye.
Aye.
Opposed? Nay. All right. I guess we do have we do roll call then?
If I may, Mayor Emersil, how do you vote?
Aye.
Thank you. Madam Chair, the motion passes.
Wonderful. Thank you. Thank you, Patrick. And everyone talk to their folks about getting a plan in quickly. We want to, if Queen Creek, Buckeye Mesa are going to have all this electric vehicle activity, we gotta have charging to take advantage of it. Now we have what may be the main event today, the point in time count, an update on regional homelessness, and we will welcome our regional homeless program manager, Brian.
Madam Chair, members of Regional Council, how are you? So presenting on this, as usual, MAG worked with coordinators and volunteers in all jurisdictions to put together a point in time count. We did this so that we could send some numbers to HUD back in Washington, DC. Let's get to the numbers though.
Yeah.
So as you'll see, how are we there?
Better.
Better? I can do that.
It's the one thing that was set up for short people.
Sir. Great. So, direct your attention to the far right, the bar there. The top number represents what we caught out of the count this year. That's sheltered and unsheltered, 9,435. So, you know, the kind of the headline was going to be slight reduction, but I want to emphasize something that we probably say every year. We're talking about a 2% reduction. We're talking about folks went out. We try not to look at this as hard data in terms of our performance measures throughout the year, but more as a minimum, right? What do the trend lines show? But what we did find that was very interesting. So you can see the 2% reduction there, but we saw a 17% reduction in folks living unsheltered on the street, in parks, in cars, in river bottoms, etc. And then we saw a 13% increase in the number of people living indoors in a shelter setting. So that, for these purposes, would include emergency shelter, transitional housing, or safe haven. And, you know, that is an achievement. That's a significant achievement, and it represents a lot of hard work on behalf of the communities here who put up those shelters. So we're excited to report back on that. We also want to talk a little bit about some of the other things that were included in the count that we look at every year. So this is just to identify that there were some changes in the demographic breakdown that we noticed. You'll see a 1% increase in both folks identifying as Black, African American, and African, as well as American Indian, Alaska Native, or Indigenous. So 1% in both categories. That doesn't feel like a lot, but you have to know that those are already overrepresented numbers, which just means that there are more people in the homeless population than in the general population. So it's something that we take consideration of, and we'll be paying attention to that throughout the year. Meanwhile, we saw a reduction in people identifying as white, and that's also probably important to note. In terms of subpopulations of folks experiencing homelessness, we just kind of further emphasize these are relatively small numbers, significant, important to watch. But for example, with families, we saw a slight increase, 6%. We're talking about 35 people. So, you know, however many families that would represent, but that's not a huge number. What it does is it tells us kind of trends and things to keep an eye on in the coming years and throughout the year as we do our work. Small decrease in unaccompanied youth and youth who are in the transition age zone, so 18 to 24.
Brian, would you just to clarify back?
Yeah.
When you say that's 598 individuals
Yes,
who
there
are identified as part of families, it's not 598 families?
That's correct.
Okay.
Yep. Veterans, we saw that population decrease slightly. And then chronic homelessness, we saw that go up. So among all of these numbers, I think that was probably the largest increase in terms of people counted. One thing, you know, that just sort of goes back to the narrative I think that we keep coming back to, which is that we have to house people, not just shelter them. And so until they're housed, they continue to be homeless. And as long as that happens, over time, they become chronically homeless. So lots of work has happened, good work. We have lots of work left to do. We already we know that. Additional populations that we take note of here. We've got folks who self-report mental illness, substance use, living with HIV/AIDS, and folks who are fleeing domestic violence. Among these groups, the one that we're really looking at most closely, you can see folks living with HIV/AIDS, that number went up significantly. We don't really know why. That's a little bit unusual, so we'll be researching that and working on the findings. a few methodological changes that we just mentioned. This goes to kind of the work that your folks are doing out in the field. So we shortened the survey tool. One of the things that we try really hard to do is to focus on interviews as opposed to observation. So if you see a person who's sleeping on a bus stop, you can count that person just by saying, I saw a person. But ideally, you go have a conversation with them. And you can say, where are you from? How do you identify in terms of your gender, your race, et cetera? That helps us deduplicate those folks in the count. It's important to get that data. Typically, we're around the 40% mark for interviews versus observations. So we shortened the tool this year to get more interviews. People told us that the interviews were too long. Folks would just walk away in the middle, so we shortened it. 16 questions is what's required by HUD. We asked a lot of additional questions. Given the size of the people who actually answered those questions, 40%, it wasn't super helpful, right? We asked questions about, do you have a pet? Why won't you stay in shelter, et cetera? But if too few people tell you the answer to those questions, it doesn't really give you any information to work with. So first, get the number up, then maybe we add other stuff. We also phased out paper surveys and really focused on a standard online training format. So we just saw better results with those things. And I'm happy to report, as a result, we went from 39% to 46% interview, as opposed to observation. Even as the total number went down slightly. Now, you don't want to blame everything on the weather, but it was raining cats and dogs. And I'm going to say that next year, if it's not raining, I hope to see that number go up and to increase the numbers of interviews further. So just as a recap real quick, we saw a shift from unsheltered to sheltered, huge achievement. Saw some changes in race, ethnicity. We saw some variation in the subpopulations. And then methodological approach, would like to just emphasize that we see that as a success. We hope that worked well for folks in your communities, and we hope to repeat that this year as well. Last but not least, thank you to everybody who participated. Couldn't do it without you. And that's all I got.
Thank you, Brian. Lots of work to do, but some good news there.
Yep.
Mayor Harkey.
Thank you, Ryan. I do have one question. I know that when we got our numbers, we had a little bit of dispute on those. So how did you work with the cities, once this data was accumulated and then sent back? What was the process? What is the process?
So we only distribute broadly to the community at large, city by city data around unsheltered homelessness. So you'll see who counted whom in every city. You won't see where shelters are, where housing is. We have all of that data, but we don't typically make that public because it's real in the weeds. For example, you could have somebody, a nonprofit could be headquartered in one city, but have housing units in a different city. And so when you look at the data, it would say all of that is in one city, but in reality, it's in two cities. So we don't really distribute that broadly. I will say, and I'll own this, we tried an experiment this year where we sent some of that data out just to say, hey, look, this is what HUD says that you have, right? It says you've got this many units. Probably won't do that next year. It's caused a little bit of confusion, but I would say broadly, we try to be transparent with those numbers. I'm happy to go more in depth on that. It'd probably be better to do it with a spreadsheet in front of us because I can really drill down and show you exactly what's in your community.
I guess maybe the heart of my question is what is the process or how is that engaged? I do know every city got their own, and but is that ongoing? Has that all been resolved since this was first sent out to cities?
For sure.
Have changes been made with city inputs? That's more the heart of my question, not the nitty gritty.
Yep. So there's two sets of numbers that get submitted. One is the unsheltered count. That count happens on the 22nd of January. We do some data crunching and it gets submitted. Typically, there's not a lot of dispute on that. It is what it is. The numbers that the other set of numbers is how much housing there's, shelter, apartments, et cetera. That trickles in. Communities report that to us. we don't have a lot of control on how fast that comes in. So there are changes over time. And then in addition to that, this year, HUD pushed back the date of submission because there was a hiccup with a system that we used to submit that data. So I would just say the data changed a few times. And that's part of the reason I think we've, you really have to go through with a fine tooth comb to understand what you're looking at. And so to answer your question, it's been resolved. HUD has the numbers and their final numbers.
Okay, and with that, that was with, again, I guess you're not hearing the heart of my question, or I'm not communicating well, is obviously as member cities who are engaged, is there an ongoing interaction before final numbers are released to HUD? Again, the ground cities are kind of the ground experts on this. I know this is the accumulation of the data, but if there is a dispute, is there an ongoing way to resolve any differences of how this is being looked at? That's the heart of my question, not the data which you're focusing on.
So historically, there hasn't been a back and forth other than with the providers who report it. So we reach out to nonprofits and say, how many bids do you have? And then they tell us. And we don't typically go to city staff and say, hey, here's what we heard. Can you verify? Do you dispute, et cetera? And typically that's always been the process. I'm happy to review that though. And if you have suggestions about how we can improve it, we'd love to hear them.
Yeah. I just would like to make sure that, again, as member cities, they've got a lot of input in this process. And at the end of the day, if it's a agree to disagree, but there is that process, that's, I guess I'm still not hearing that. That's what I'm asking.
Thank you. Chair Gallego and members of Regional Council. Mayor Harkey, we definitely go back and forth with staff, and we did this year in several of our cities that when they got the initial data, they did not agree with those numbers. And we sat down with them and members of our Radical Analytics Division here at MAG to make sure that the data was as accurate as possible. As Brian mentioned in his presentation, sometimes we have people that are duplicates. They're counted. And so we do get that confusion sometimes. And our RAD division takes quite a bit of time to go through all of the data, which is why it's taken so long since the January count for us to come before you today. So we are in regular communication. And I know that in particular, your staff did reach out, and we did go back and forth with them on the numbers to try to make sure that we had the most accurate representation for your community and other communities. I'll give you one other real quick example. We had one of our smaller communities, smaller member agencies, where we had 5 people that were reported. The staff person from that town reached out to us and said, I was in charge of the point in time count and I didn't find anybody. So how did you find these 5 people? Why do we have 5 people represented? Come to find out, they had a county island where they had another organization that was there that had counted those individuals and reported them within their town limits. And we had to sort that out as well. So sometimes there are hiccups, but we're definitely in regular communication with those of you who have a human service staff to try to make sure that the data is reported as accurately as possible.
Great. Thank you. That was what I was asking.
Mayor Weiss.
So there's good news in this. We look at the unsheltered population that has dropped, the sheltered population, ideally transitioning to permanent housing and coming off the street. There's 2 concerns that I have. One is still the increase of people who experience chronic homelessness, which I'd like to get a deeper dive on that sometime in the future because I think when we go out and we talk to people, there is a certain population that chooses to live the way they live. They're not going to move into a shelter. They're not going to do anything different than what they're doing. And I don't know how you reach those people. I don't know how you convince them to change. The one that really jumped out, and it's one that you highlighted, was the jump in HIV/AIDS. And I'm wondering if that is a corresponding issue with intravenous drug use, unprotected sex, other issues that happen with a vulnerable population that is immunocompromised. How long do you think it would take? How long do you think it's going to take your team to kind of figure out why that increased? Because that's a big jump in 1 year.
Well, tough to speculate as to how long, but I think our first step is going to be to try to coordinate with public health, just see if they've noticed any similar trends. They also track instances of homelessness. So we'll probably go there first and just see if there's something that we don't know about that's happening with respect to HIV/AIDS that just overlaps. That would be the simplest solution, I think.
Right. And I think that's important for the cities, because is this an anomaly that is happening in just that population, or are we seeing something more and this is just, we caught this by luck? So that's kind of where I'm going with that. And whatever the time it is, I would just kind of like to get some follow-up information. And it may not come from MAG, but it may come from the county or the state health departments to say, yes, we investigated this and this is what we saw, this is what we found. So
We know somebody at County Health now, so
We will follow up on those specific questions, Mayor.
Mayor Wilson.
Yeah, I'd just like to know in the aspects for the AIDS in the aspect, how was that discovered? Are we doing something different than we've done in the past? Or is this something that's actually been I'll say tested for?
sir, could I get you to clarify just on what?
Was the AIDS data self-reported?
Yes.
Got it. Yes, sir. It's self-reported. So when you talk to somebody and you say, hey, do you identify as somebody who's living with HIV/AIDS? Folks can say yes or no or decline to state. And so, look, the easiest answer to this is just that we're doing a better job getting that data from folks. Because you can imagine that's not the easiest thing to answer in an interview with a person you just met for the first time at 5 a.m. and it's raining. So it could just be that our folks are better trained or they're, we'll have to see. This is a trend that we're going to continue to follow, I think.
But Brian, that's one of the 16 questions that is on that instrument. Is that correct? I think that was Mayor Wilson's question.
Yeah, that's
How did we know it was a specific question asked? And that's a question asked across the United States.
Yes. So those 16 questions that we have to ask that HUD requires to do a point in time count, everybody in every community that does a point in time count for HUD, they ask those same questions. So
And then has HUD released the data nationwide to see if the nationwide those HIV/AIDS numbers are up, or is it too soon to know that?
That's a great question. And so it's probably too soon to say for this year, but we can certainly report back on it. So as soon as HUD publishes the nationwide 2024 point in time count numbers, which they'll do to Congress, I feel like that happens at the end of the summer. We'll be able to check into that and look at this year's numbers versus last year's numbers.
Are
Mayor
our
Dickey.
numbers available somewhere online? You said that nationwide it would be the end of the summer, but what about, are these things public?
They're going up on the website today,
Oh, okay.
as soon
thank
as this meeting's done. Yep.
You're the last stop before it goes broadly to the public. So we wanted to report to you. Then there will be a press release and the numbers will be officially released publicly after we're done here today.
Mayor Ortega.
Would it be fair to say that where your cooling stations are not necessarily a gathering place for unsheltered? In other words, would an average Joe perhaps be a little stranded, maybe take a break in there, or is it more of a centered for the homeless population?
That's a great question, Mayor. To be honest with you, I'm not directly involved in the heat relief centers.
Mayor Ortega, to answer your question, I would say it depends on where the heat relief station is located. We have certain heat relief stations that are located in populations where there are more individuals experiencing homelessness. I'll tell you, there's a library right around the corner from my house. I live in Mesa, Mayor Giles area, and that heat relief station is primarily used by older adults who cannot afford to keep their air conditioning on during the day. So it's a real mix of people. I think it has to do, again, just more with location and the population who's living in that area.
And I think that's a strong and meaningful awareness community-wide, that it's not just for, those that are displaced, but actually maybe even a social gathering area where information could be shared and gathered. Okay, thank you.
Mayor Giles.
I understand that this is mandated by HUD and that there's some value, obviously, in waking mayors up on a cold January morning and having us go out and actually see homeless people. That's useful. But I hope no one really thinks that this is the right way to count homeless people. I think if we were to go to our human service agencies and say, congratulations, there was a 2% reduction in homelessness in the county, there'd be some laughter and some raised eyebrows. Certainly, I would love to gloat and say there was a 16% reduction in homelessness in Mesa, according to this count. That's absolutely not true. Last year, in 2023, we gave homeless services to 5,454 people. That is not a reduction, that's an increase. And so I think as we send out this information, I just hope that we all retain the narrative that this is nothing more than a point in time. And it depends on what the weather is, what the volunteers are, what the methodology you're using. But it would be a false narrative to say, look, we're making progress in housing our unsheltered in Maricopa County. That's just sadly not the case.
I guess I would push back a little in that we did have a large increase in sheltered that was because of the work of
Thank you.
member
Yeah,
agencies.
Yes, and I think we all ought to take pride in that.
Mhm.
Those are actual real people.
Yep.
So you're right.
Mhm.
I do, I'll pat us all on the back for that.
I think it is progress. We have never funded more beds and look, the biggest point of pride was not having to need to fund beds, but we are stepping up for those who are most vulnerable. So we'll turn to Mayor Weiss.
I think my last statement is, I think when you talk about your methodology improving, and as this gets better over time, as the team goes out, I think there, and you mentioned the County Island, I think especially in the West Valley, and I don't know the East Valley well enough to speak intelligently on it, but I will tell you that the river bottom, whether it's the Agua Fria, Gila, or Salt, play a big place for the homeless population to gather. And those don't fall under the jurisdiction of Buckeye, Tolleson, Litchfield Park, Avondale, Goodyear. They just don't. So when the teams go out and count, there's a population that tries to go down. There are groups that try and go down the river bottom to count people, but those camps are transient and they move. And again, my hope is that in the future we get more nimble in what we do. I'm not disparaging the work that's been done, because I think the work that's been done has been incredible. To your point, I think our homeless count last year was 45 or 53. Yet our Sonar team got 61 people into temporary and permanent housing this last year in Avondale. Those numbers don't jive, right? So it's a transient population, and I want us to get more nimble on this. I think we all want the numbers to be as accurate as we possibly can, so we know what we're dealing with. And our people on the ground in Avondale have a really good idea of the numbers, but that doesn't reflect to a county, state, or federal level for help that we may need to help that population.
Chair Gallego and members of Regional Council, I would just make two final points also. One is that I've always said the silver lining of the point in time count is that we have over 1,000 volunteers who come out that day, many of whom have never interacted with individuals experiencing homelessness. You're really changing the hearts of people who live in neighborhoods who may or may not know how to interact with the individual who's living near their home. And we hear so many great stories of people who say, I understand it better now. I understand what, how I'm getting this issue better. And so we really look at it as a great opportunity. And I think Brian was going to get here, so I'm sorry to step on his toes. But what I will say is we could not do this without all of you and all of the staff that at your member agencies and their participation and the volunteer coordination. It really is a regional effort to make this happen every year. And while we recognize that it is not the most accurate count of our homeless system, we do have great data through our homeless management information system that we can help report on that gives us a much clearer view of who's coming in and out. And so we would be more than happy to come back with you with those numbers as well.
And I think to Mayor Giles's point, none of the professionals in this would pick this methodology as the sole source of information on homelessness at one day where, it's the odds are what? Well, we had a downpour, what are the odds in Phoenix? I think to the point though is if you look at the trend over time, it sort of makes sense to what people experienced between 2018 and today. And the positive point of more people in shelter is a reflection of the work that you all have done in your communities together. But beyond that, to say this is the definitive number, we can't do that. Unfortunately, this is what HUD requires, and it's what the media can focus on. So for today and tomorrow, this is probably going to be the story, but the refinements that you all have, I think what we've heard today are really important, and your staff have those talking points and you do, and that's important. But mostly I think it reflects the investment and the work that's gone on in the region to try and shift the numbers as best we can.
Great. We'll go to Mayor Hartkrey and then Mayor Wires.
So I do agree. And I think we have gotten more accurate as well as seeing the rise, but you mentioned some changes this year that have been improvements, like doing away with paper, training, universal, et cetera. Do you, any ahas that on maybe that what we would potentially implement next year? I don't want to hold you to that till it's vetted, but any thoughts on how even the limitations of this process, that your experience or your observations that we could do to make it better?
That's a great question. I think honestly, the main one that comes to mind is consistency. So making sure that we do it the same way every year. I was lucky that my predecessor kind of left a roadmap on how to do this well. I'm hopeful to do it again myself next year so that I can make sure that I do everything the same way and then improve on all those steps that I missed and catch everything that all of that matters, right? You need one person kind of helming this because it's a lot of coordination. We see turnover in every community. So that's where I would start. And then I do think the stuff that we put up there about, digital tools, we're using phones with mobile connectivity. I mean, all of that's really critical. And I will say they don't have that in other communities. I've done this count in 3 different cities at this point over the course of my years since 2013 when I started doing these. Nobody has GIS baked into it, right? Because of Mag's work in this role. And we even talked to Tucson. They're having to haggle out cost rates with ArcGIS just to get this done online, right? So that already is a good start. And I think we're well on our way to having a consistent count that happens the same way every year. I would start there. And frankly, if we can turn out this type of result that gives us a baseline number, a minimum, here's where we're at every single year, and we get community engagement backing that, I think we win, right? That's a good thing for the community. It's not that this is a super resource intensive effort, it's not nothing, but it's also, I think it's a way to turn out people and communicate this issue to the public.
Mayor Wires.
Thank you. This is not a question for you. It's really more of an observation that I think people aren't looking at. Our population, since I've lived in Arizona since '66, every year has continuously grown every year. And there's not a person in here that would argue with that. But I think that one thing that people are not paying attention to is as our population continues to grow, and it has, that's gone down. And so to me, I think that there's a bigger success than what we're realizing, just in the fact a higher population theoretically should have been a higher homelessness population also. So I think we're accomplishing, I don't think we're going to get there exactly the way we want to get there, but I think we are making a difference. I would love to see a comparison with a city that has a declining population and see what their homeless count has done compared to ours with a similar population. I think that'd be really interesting to see how that compares.
Okay. I think we had several different comments from this body about wanting to compare our data to other cities or see what's happening in HIV/AIDS in other communities. So maybe it would be good to get some level setting. The head of the U.S. Interagency Council on Homelessness was in town and did share with me that he thought our region was really doing quite well in terms of a change in how many sheltered beds we have. So making some progress and reversing not all of the trends we want to reverse, but some of them. So that is always perspective, because if we're going to keep making these investments, we got to make the case to our residents that they make a difference. Will you talk a little bit about the geographic distribution of the new beds since COVID?
Yeah, you bet. One thing I can tell you is that a lot of it's centralized. I think that kind of goes without saying. If you look, we did not include a slide on here, actually. We had to keep this deck pretty tight, but we have, imagine like a map of the whole region, and then every, so 9,000 points on that map, each one representing a human being who got counted. You'll see that it's everywhere, right? It's very, very much spread around the region, but highly concentrated as well. So, that's a reality. And I think as a result of that, or for whatever reason, Phoenix has done a large part of the work in standing up shelters. I think historically that's been true as well. So looking at the numbers recently, yeah, we see probably an 80%, slightly above 80% concentration in shelter space in the Phoenix Central area. And I would just say that it's a good idea to have shelter in as many parts of the community as you can, because we know that homelessness exists everywhere.
Thank you. We are trying to step up as much as possible and we'll continue to do so, but we can make more progress if more and more communities step up. The majority of the evictions happen outside of Phoenix and the county, although we got way too many evictions to begin with.
One other thought to mention is we hear over and over again from people experiencing homelessness and from folks calling in on behalf of family members and from folks who do this type of work. People experience homelessness in their communities almost all the time. 75% of the time, they're folks who were from that community, who ran into hard times, something happened, they have mental health issues, whatever the case is. We see a lot of that. And so to that end, I think it makes a lot of sense to try to keep people close to where they're from, where the community is. So that's, that's another way to look at it as well.
Well, thank you for this very important update. There is a huge amount of interest in the community and you're going to have a very busy week. We next go to the air quality update and we will welcome our environmental director, Matt.
Actually, Mayor, in the interest of time, there is not a whole lot new to report on air quality other than it is ozone season. We are seeing exceedances. We are seeing the effects of the wildfire north of Cave Creek. We continue to monitor that and continue to work with our partners at Maricopa County and ADEQ. So that, just to abbreviate, that was the
Excellent report.
You're welcome.
All right, then we will turn to Ken Weiss, the chair of our nominating committee for number 10.
Thank you, Madam Chair. Nominating committee met 11 a.m. this morning to recommend the positions for the 2024-2025 MAG Regional Council Executive Committee. The recommended slate of candidates is as follows. For Chair, Mayor Kevin Harkey, City of Chandler. Vice Chair, Mayor Alexis Hermosillo, City of El Mirage. Treasurer, Mayor Eric Orsborn from the great city of Buckeye. 3 at-large members, Mayor. Well, I was hard on him this morning at another meeting, so I'm kissing butt right now. Mayor Bridget Peterson, Town of Gilbert. Mayor John Giles, City of Mesa. Mayor Jerry Wires, City of Glendale. Along with the past chair, you, Madam Chair, Mayor Kate Gallegos, City of Phoenix. Election of officers will take place at the annual meeting of MAG Regional Council on June 26, 2024. I'd like to thank the members of the committee for agreeing to serve alongside me. Mayor Skip Hall, City of Surprise. Mayor Tom Schoaf from the City of Litchfield Park. Mayor Julia Wheatley, the Mayor of Town of Queen Creek. Mayor Corey Wood, City of Tempe. And I'm supposed to say it has been my pleasure to serve as chair of your nominating committee, but it really has.
Any questions or comments? Thank you for your service, Mr. Chairman. Executive Director's Report.
Mayor, just very briefly, I'm going to skip all of it except for one thing I do want to call your attention to, and that is that there is now available to you and your staff and the entire public, this is on the MAG website, the Prop 479 education page, azmag.gov/Prop 479. Take some time when you have it, with a little bit of extra time you may have, to just scroll through it. It is a deep resource of all the work that's gone into it for the past 5-6 years. It shows what will be shown on the ballot, what it is, and it's a great resource. I do also want to commend at least these 2 cities. There may be others who've done it, but I'm aware of the City of Surprise and the Town of Queen Creek have both created their own city Prop 479 web pages to drill into specifically, in the case of Surprise, what is in Prop 479 for the City of Surprise. Mayor Wheatley has a double challenge, which is she has both a Prop 479 in Maricopa County and a Prop 486, something like that, in her Pinal County portion of Queen Creek, that are both transportation propositions. So Queen Creek has a website that drills into both, but those have drawn on the resources that are available on the MAG website. And again, this is available to the public. It is not a pro or a con. It is simply a rich resource, and we make that available to you. I want to thank Audra Kester Thomas and our communication staff for putting that together. Thank you, Mayor.
Thank you. Very useful resource and great idea from Queen Creek and Surprise with their
Queen Creek and
websites.
Surprise.
Legislative update. Do we?
You guys probably know as much as we do.
Great.
So no.
Request for future agenda items. Comments from the committee.
Madam Chair.
Mayor Weiss.
The only comment I would make, if you didn't hear the news, NASCAR awarded the region the 2025 championship race. So we'll have it for 6 years in a row. You're going to get an ask from our team at Avondale going forward, as the previous host city, which is Homestead, Florida, is looking to bring the race back to that improved track. And it's going to take a regional get and regional effort to bring the race back in future years. So you'll be hearing from the city of Avondale long after I'm gone, but just be aware of that. But thank you to everyone who helped us get the 2025 race. Thank you.
Congratulations. Good year. I think Mayor Bazil has left, but he won 3-1. His general plan did yesterday. So congrats on a very successful election. And we will, Anubhav, I think, has announced his retirement. So very grateful to him, to his service to MAG. And then Kelly, congratulations as well. We are adjourned. We'll see you on Wednesday, the 26th.